Hello everyone, welcome to an Upgrade Your OET lesson with me, Sona, from Bose Learning. Today's lesson is all about cellulitis, and we're going to do a little bit of speaking practice and some listening practice as well. What we're going to cover in this session is a typical GP scenario. So the speaking practice we're going to be looking at is very good if you're a doctor and doing the medicine OET test, but it's also good practice for all you other healthcare professionals as well, because we're going to be doing some listening practice as well. We're going to focus on signposting and explaining, and that of course is part of the OET speaking criteria, and that's what you're going to be assessed on. We're going to listen to how that's done very naturally by a GP working in her everyday life. As we're listening, we're also going to be developing your listening skills, so really focusing in on individual words and rhythm, and we're also going to do some pronunciation practice. If you like these videos, please don't forget to click on that like button, share it with a friend or a colleague, and subscribe to us. And just to remind you, I'm a premium preparation provider of the OET. I don't have any medical experience myself. I'm just an English teacher who's got lots of experience teaching English, and as I say, I'm a premium preparation provider. So all my medical sources come from trusted online sources that I always quote, and you can find in the comments box below. So this is the situation that I want you to think about. A 70-year-old long-term patient of yours has presented to you with an insect bite to her leg. That's nothing so strange, and normally, of course, insect bites can be treated quite easily. However, you suspect cellulitis, judging from the appearance of the skin. This is an acute bacterial infection of the dermis and subcutaneous tissue, and you think the surrounding area of the bite has cellulitis. You therefore think she needs antibiotic prophylaxis. For more information about cellulitis, take a look at the NICE website. I've got the link below, but as you can see here, the diagnosis can be made on taking history and examination alone. So, what questions would you ask if you were in this situation? This is a patient you know quite well. She's 70 years old, and she comes to you with an insect bite that you think needs antibiotic treatment. 30 seconds to think about what questions you would ask your patient in this situation. Okay, I'd also like you to think about what advice or warnings would you give, particularly in treating and looking after the bite. Some of what you're going to be doing in your OET is asking questions, information gathering, and then information giving. And that's what we're going to look at here. So 30 seconds to think about what information you could give your patient in terms of advice or warnings. Okay, let's listen to the extract now and see if you were right. So you're listening in particular for two things. What questions does the doctor ask the patient? And then what advice and what warnings does she give the patient? As I say, this doctor and patient know each other very well, so you'll be able to hear from the way they speak to each other that they're quite familiar with each other. Okay, let's listen.
Hello, Doreen, come in. Oh,
How are you?
I'm not too bad, thank you.
Good. What can I do?
I seem to have been bitten by an insect.
Oh, where?
Leg, I'm afraid.
Doreen, you poor thing. Put your foot up. You need the antibiotics.
Antibiotics?
Absolutely, it's spreading. Look, all that redness. The actual strong red bit's about 3.5 centimetres by 1.5. When did you...
Yesterday.
Oh, good. And that's come from yesterday?
Yes.
Did you feel the little biter?
No, I didn't feel anything.
You never see them, usually, do you? Well, it's pretty powerful, isn't it?
It is.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Because that should start to get smaller over the next 2 days. If it's not, you've got to ask to be seen by the emergency doctor. Because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
Oh, dear.
So the questions that you heard then were, when did it happen? And it was yesterday that this insect bite took place. And the doctor wanted to know what kind of insect was it. Did you see the biter? She informally calls the insect the biter because it's bitten the patient. And the patient hasn't seen what actually bit her, but that's of no great consequence in this case. The advice and warnings that were given were to rest the leg, to watch in case that redness spreads any further, and to seek help immediately if the redness spreads. Let's focus in on these questions and advice in particular. And what I've got here for you are some gap fills to do. So these are all things that the doctor says. I would like you to listen again and then fill in the gaps for me. You can listen to this several times, just rewind it, have a look to the timestamp, and then you can rewind it as often as you need. I'm just going to play it for you once this time.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Because that should start to get smaller.
Okay, how did you go? So the first one then was, because that's a difficult part of the body to heal, it means you have to be jolly careful with it. So let's try this together. There's quite a few words here, but the rhythm is, that's a difficult part of the body to heal. So repeat with me. That's a difficult part of the body to heal. Part of the body. It means you have to be jolly careful with it. Jolly in this case is an informal and a little bit off an old-fashioned way of saying very careful. Jolly careful means very careful. She also tells her patient, try not to bump it. Try not to bump it. Try with me. Try not to bump it. Bump, of course, means to hit accidentally. Put it up the foot. So she tells the patient to put it up, and then she remembers to say she means put the foot up. So pronunciation here, put it up, and watch it, because that should start to get smaller. That should start to get smaller.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Because that should start to get smaller.
Here are some more for you to listen to.
If it's not, you've got to ask to be seen by the emergency doctor. Because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
And this time we're focusing in on that advice. If it's not getting smaller, you've got to ask to be seen by the emergency doctor. You've got to. That's quite strong. You must, in other words. You've got to ask to be seen by the emergency doctor. Because that's serious, you know? So she's emphasising it in quite black and white terms because that's serious, you know? So that's a little bit informal here, but as I say, she knows the patient quite well. If it's getting very much worse, you're going to need intravenous antibiotics. So she explains what could happen. If it's getting very much worse, you're going to need intravenous antibiotics. And then there's that reassurance, of course. But hopefully none of this is going to happen.
If it's not, you've got to ask to be seen by the emergency doctor because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh,
But hopefully none of this is going to happen.
okay. Great.
Okay, so I hope you found this lesson useful. Why not watch one of our other videos right now? You can practice some more speaking perhaps, or look at some more vocabulary with me. And if you want more information about our on-demand courses, which are all pre-recorded so you can watch them and re-watch them in your own time, then take a look at the information box in the comments below because I've got some discount codes in there for you. Thanks very much for watching. Take care then. See you next time. Bye bye.